Hello, everybody. Welcome to this following episode. In this episode, I'm going to be going over uh, dental rehabilitation, which is kind of similar to dental reconstruction, which I spoke in an earlier episode. But there's a significant difference that I'll be going over in this coming episode. So without further ado, as always, I'm not a dentist. I do have many years of experience in the dental field, helping dentists with patients, explaining to patients in a more simple way on what dental procedures are, what the dentist found, what could have potentially caused a person to get into the situations that they're in, and what can they do to get out of it, as well as going over a lot of different financial things that they can take in order to get the person back to their original oral health or get them to a state where they've always wanted to be in. So without further ado, dental rehabilitation. So dental rehabilitation is um, just like how the word says, which is different than reconstruction. So when you rehabilitate something, it's something that worked originally in a specific way, in a specific manner, and then it stopped doing that. So if a person, let's say they had all their teeth, let's say their teeth were straight or if they were crooked, and then for some reason, let's say they might have been young and they didn't have their wisdom teeth out, but they did get aligners, and then later down the road, their wisdom teeth come out and they didn't come out in the most adequate way, so they push their teeth and they become crooked again. They become crowded. That can happen, and that would be considered rehabilitation. In addition to that, somebody who, for example, has a lot of root canals that they have to do on their teeth, but they don't want to get extractions. While it can be expensive, a person in those situations normally can't eat the same way they were before. They have bruxism as well, and they grind their teeth a lot. So we would rehabilitate the teeth back to the way they were, to where the person was happy with their teeth. Whereas when reconstruction, like I had spoken before, somebody who, you know, their mouth is just, in most situations, they had all their teeth extracted, so they're wearing dentures, or they had most teeth extracted, or they just fell off, or things like that that are not necessarily 100% with all teeth. Whereas rehabilitation normally has to do with the mouth itself and the teeth that are in there. So like I was saying, a rehabilitation is normally what happens is that the patient comes into the office. They can have, sometimes they come in with a lot of pain in an area. A doctor does x-rays, we do the examination. And when the doctor does the examination, he sees that the person, not only do they have that one tooth that's in a bad condition, but they also have many other teeth that are in bad conditions. And he's pretty much, or she is in danger of either maybe getting a big partial, maybe losing the ability to eat on one side, or they're just in a very bad situation. It could be something with their gums too. They might have severe gum loss, and they're in danger of losing all their teeth. So, and then again, it could be, like I said before, something as simple as they they had they had might have had braces before, and now that they're older, their teeth might have gotten crowded again. It could be either because their wisdom teeth came out and they don't fit in their mouth, or it could be that the person just didn't use the retainers the way they were supposed to after they got done with their treatment, and their teeth got crowded again. That happened to me when I was younger, and I had to get aligners again, to get my teeth straightened again because I didn't follow the retainers. So when that happens, the doctor, the first thing he does is that he looks at the patient, he sees what it is that's bothering them. We take care of that immediately. It could be a root canal, it can be a broken tooth, it can be anything. And then after that, we talk to the patient and we explain to them that in order for them to get their mouth working properly the way it did before, then they're going to need what's called a full mouth rehabilitation. So when we do a full mouth rehabilitation, it's the same thing. Doctor looks at every single teeth individually. He finds out what problems are in every single teeth. He also looks at the overall structure of the mouth, like their bite, for example, the alignment of their teeth when they bite down, see how much it's off, if there is bruxism, if a person snores, if they have TMJ, so on and so forth. They do an evaluation on all of these things, and then from everything we talk to the person. We get a historic background on the individual. When did this start, how long has it happened for, if there's anything else that they might have that they have attention on, that moment they might just want to tell the dentist. It is happens all the time. A lot of people assume that a dentist is just going to figure out whatever a patient has, but in reality, it's not true. And it's not only in the dental field, it's even in the medical field. It is very important for patients to be very open with their doctors, because if what we might see or what a doctor might see to be perfectly fine to a patient, it might not be. And at the end of the day, what really matters is your happiness. So, when you go to the dentist, when you go to any doctor, please make sure to, give them all the information and let them know what it is that you want to take care of outside of the emergency that you may have at that moment. So again, when a doctor does a rehabilitation, he looks for all that stuff, and again, we ask the patients, and once we get a full story of everything, then we figure out, okay, well, we find out what the origin is on what might have caused all the situations that they're in. It can be anywhere from maybe they could have gotten stressed in their life and they got adaptive bruxism, and now that they have bruxism, they're getting a lot of cavities because they're losing a lot of enamel on their teeth. It could be something as simple as maybe they had a financial situation before and they just didn't take care of their mouth anymore, and now they have periodontal disease. There's those are very specific examples, but there's just thousands of reasons why things can happen, especially in your mouth. So when the doctor figures out what the origin of things are, then it's very easy to go from to just reverse engineer a person's situation. And normally what you would do, instead of saying, okay, you have a lot of cavities, let's just do fillings, if the person is adapting bruxism, then we would give them a night guard, and that way it would help them with their bruxism, and then after that do fillings, and then get their teeth back to the way they were before. And or if they need crowns, add crowns into those teeth and get it back to the way it was before. And then the night guard is going to protect them from them further damaging their teeth, as well as from them damaging the work that they just got done. That's a very simple thing. Another thing would be if somebody has multiple root canals, they have a lot of teeth that are in very bad conditions, and we look at the mouth and we notice that their teeth are crowding, then it could be because they have their wisdom teeth, and then they haven't been to the dentist in a long time because they could have said that they never felt any pain. So in those situations, we obviously help the patient with the pain that they're in doing the root canals, but at the same time we suggest, hey, look, it would be a good idea for you to remove your wisdom teeth, because one of the reasons why this got this way is because of the crowdiness of your mouth. Your teeth might have gone so crowding that it could have messed up your bite, and that caused your teeth to get into the situation. In addition to the crowdiness, you're more than likely to get cavities when you have crowdiness in your teeth. So, also advise a person to potentially get aligners. So these are all things that have to do with rehabilitating the person's mouth, and getting it back to its working function as to how it was before, which is a major difference to a reconstruction, because we're not building it again, we're just grabbing everything and putting it back to the way it was before, in a more optimal situation. So yeah, that's pretty much it for full mouth rehabilitation. So as always, flourish and prosper, and have a good day.